This is Anxious Minds, and this is Sean speaking. Today, the topic is schizophrenia. Schizophrenia is a chronic and very severe mental health disorder that affects how a person thinks, feels, and behaves. So people with schizophrenia may seem like they have lost touch with reality. And although schizophrenia is not as common as other mental health disorders, the symptoms can be very, very disabling for an individual, for a person. And the symptoms of schizophrenia usually start between the ages of around 16-year-old up to about the age of 30. And in rare cases, children can have schizophrenia also. So the symptoms of schizophrenia fall into what we call three categories: positive, negative, and cognitive. The positive symptoms are what we call psychotic behaviours, not generally seen in healthy people, or people with positive symptoms may lose touch with some aspects of their reality. So their symptoms might include things like hallucinations, which of course can be very, very scary for anybody. Very, very scary indeed. Delusions, and what we call thought disorders, or unusual or dysfunctional ways of thinking. Movement disorders, or agitated body movements. The next area may be what we call negative symptoms, and these negative symptoms are associated with the disruptions to normal emotions and behaviours. And some of those symptoms might include things like what you call the flat effect, or a reduced expression of emotions via facial expressions or voice tones, reduced feelings of pleasure in everyday life, and difficulty beginning and actually sustaining activities, and reduced speaking, or in other words, the person will be very, very quiet compared to what they normally are. And the cognitive symptoms, i.e. the thinking, for some individuals, the cognitive symptoms of schizophrenia are very, very subtle, and they could be very, very difficult for a lot of people to actually spot, including mental health professionals. But for others, they're much, much more severe, and people may notice, and the patients actually may notice, changes in their own memory or other aspects of their thinking. And so some of their symptoms might include what we call poor executive functioning, or what that means is it's the ability to understand information and use that information to make good decisions. Another symptom might be something like a trouble focusing or paying attention to what is around them or to what's being said to them, and also problems with what we call working memory. That is the ability to use information immediately after learning it.